Hi everyone, I'm Moika Vetani. I have a pleasure to invite Dr. Jane Warland, who is an Associate Professor at the School of Nursing and Midwifery at the University of South Australia. She's a passionate researcher into preventive risk factors for stillbirth, as well as promoting awareness of stillbirth. Her program of research is STELLAR, which is stillbirth, teaching, epidemiology, loss, learning, awareness, and risk.
Thank you for the invitation to talk to you tonight. Dr. Pridmore is very close and dear to my heart. He was my obstetrician for my babies years ago when I birthed down at the Old Queen Liz. So it's a particular pleasure of mine to be talking in a forum named after him. I'm going to be starting off or kicking this off by talking to you about how we might discuss fetal movements with women during pregnancy. You see at the bottom of this slide that I have a Poll Everywhere link. If you have a smartphone with you and you'd like to participate, you can key in that pollev.com. And if you have just an ordinary phone that's not smart, if you text Jane Warland 208 to that phone number there, you'll then get a text message back which will give you a link that you can then say A, B, C or D. The other thing that I would just like to tell you is that I only have 40 licences for this particular program, so first in, best dressed. So I'm going to be spending the next 20 minutes talking to you about outlining some current research that we have, talking about the importance of fetal movements with women, how we can, why we should, and perhaps why we don't. And finally dispelling some myths. And I understand from Jodie that she's then going to be moving on to how decreased fetal movements is managed. And so I'm not going to be talking about that. I'll leave that to her. So there wouldn't be anybody in this audience who wasn't fully aware of the fact that maternal perception of a decrease in frequency of fetal movements is associated with poor pregnancy outcomes, including stillbirth. And we understand that the mechanism for that is probably the baby conserving energy in an attempt to make it alive and well to birth. I'll answer if you like. So altered fetal movements is something that is coming more into our understanding in our vernacular now, certainly from the research perspective. And I did want to just mention very recent studies which are talking about not only a decrease in frequency of fetal movements, but also decrease in strength and a change in pattern as also being important. So we have 3 case control studies which have all shown startlingly similar, actually, findings around decreased strength noticed in the last 2 weeks of the pregnancy, and also a single episode of excessive vigorous fetal activity that the mother describes as crazy, wild, ballistic, nuts, bananas, berserk, bonkers, those sorts of words. And the sometimes vigorous fetal movements have been described by the mothers as busy times. So completely different words that the women use to describe that. I'm often asked, how can we tell if it's going to be a single episode or if it's going to be more than one, if it's the first time that it's happened? And what I tell you as a clinician is that if she uses those words, crazy, wild, ballistic, nuts, bananas, bonkers, then that's a baby that we need to be concerned about and assess. Whereas if she says my baby has frequent busy times or has had a really busy time last night, then that's likely to be a baby who's well. We also have from Billy Bradford, who's an amazing New Zealand midwife who's just finishing off her PhD now, a prospective cohort of only women who gave birth to a live-born baby. And she also described, they also described increased strength and frequency in the last 2 weeks of the pregnancy and busy in the evening. So we think that changes in strength and pattern are also important for the woman to report. And so that there are three elements of fetal wellbeing: frequency, strength and pattern, that combine to give us an overall picture of fetal wellbeing. And I like to use analogy a lot when I'm teaching. I think that if we asked a woman who was ringing and telling us, "I think I'm in labour," and all you ask is about the frequency of her contractions, then you're depriving yourself of finding out about the strength and the pattern, right? So we need to ask more questions than just information about frequency. So here's your opportunity to shine. Do you never, sometimes, usually or always give information about fetal movements at the booking visit, for those of you who have logged on? This is a live response. I'll have to say that's really quite a common pattern that we're seeing there, that a lot of care providers will always give information even at the booking visit. And I guess that when I've had time to ask care providers about why they've said sometimes or usually, it tends to be for reasons that there's a lot of information to be given at that booking visit, and perhaps because the baby hasn't started to move yet, that's not considered to be important information to give to the woman. However, we have NH and MRC guidelines which suggest otherwise, and really our clinical practice guidelines say that early in the pregnancy we need to provide women with verbal and written information about what to expect from their baby moving, and to be talking even at that early stage about what to expect when you first start feeling your baby move. So what information do we give? This information on the side is from a group called Still Aware, who have produced with me a guide for clinicians called the Empowered Pregnancy Timeline. And so at that first visit, they suggest that we start a conversation, give the women the brochure that a lot of you would probably have seen. It doesn't have to be the Still Aware brochure. It's a good one, if I don't say so myself, but there's certainly other information brochures that are out there. So some written information for the woman to take home. The great thing about the Still Aware resource is that it also has a fridge magnet. So popping that on the fridge is a kind of a daily reminder for the mum to get to know her baby. Do you have a detailed discussion about the importance of fetal movements around that 16 to 20 week mark? Again, that's a really common response that we're seeing here, with always and usually being the most common responses from a group. And again, if we look at the evidence for why we should, we can look to Scotland, who've had a really quite exciting drop in stillbirth over the last few years. Maternity and Child Quality Improvement Collaborative, which is a bit of a mouthful, was established in Scotland in 2010, and they set a target that they would talk to all pregnant women, or 95% of them, which is pretty much all of them, isn't it, to have a documented conversation with them in the middle of the pregnancy. What happened in Scotland was a nearly 20% drop over the last 5 years. Linked fairly much to that initiative. There were other things that were happening in Scotland, but certainly that's a very promising factor that's been associated with that drop of stillbirth rate in Scotland, particularly in the light of other countries like Australia having a fairly static stillbirth rate. A 20% drop is really quite startling. And we again look at the clinical practice guidelines, which say that antenatal visits do provide us with an opportunity to talk to women about their baby's movements, talking to them about what's normal. So what information do you give at this point? refresh the woman's memory that she received that brochure at the beginning of the pregnancy, and that now's the time to get to know her baby's pattern of movements, strength, frequency and pattern all being important. And also talking to her about the fact that you're a team, and that if anything feels different or uneasy, to report that. You also need to be talking about what to expect, that the woman won't necessarily feel kicks straight away, that it'll be more flutters and tickles, moving to kicks, and then as the baby becomes more and more confined, it's more shrugs and rolls and chicken wings than a clear kick towards the end of the pregnancy. Do you have a conversation about the importance of fetal movements at each antenatal visit in the 3rd trimester? Again, that's a pretty typical response from the other presentations that I've given in this area. Usually or always is pretty much what clinicians will be telling us. I'd like to encourage you to think about what that discussion consists of, because a lot of care providers will say they have a discussion, or they always have a discussion at each antenatal visit. And we think that sometimes the clinician might be actually just saying, well, I ask her about fetal movements and document that. So that's the nature of the discussion. However, our clinical practice guidelines say that we need to do more than that to emphasise the importance of the mother being aware of fetal movements at each antenatal visit. And one of our STAR study participants actually said this, which I wanted to read out because it's really quite touching. I wish that my midwife had told me about the importance of fetal movements and to notify her if his movements became less frequent. I wish I had been educated about how common stillbirth was and what the signs of fetal demise are. I truly thought it was rare and that it couldn't happen to me. Healthcare professionals don't want to make expecting mothers overly anxious and paranoid, but they do need to make them aware of signs to watch for that might show their baby is in trouble. So which of these best describes how you ask pregnant women about fetal movements? And there's a few there. Is your baby moving? Is your baby moving normally? Has your baby moved today? Tell me about your baby's movements. It's pleasing to see that as I've been presenting this kind of information over the last couple of years, that there's less and less clinicians who are prepared to anyway say that, or admit that they say, is your baby moving? However, there is still that, is your baby moving normally? Now, I wanted to just point out that if you ask a closed-ended question such as, is your baby moving normally, then that gives the woman the opportunity to say yes or no. And in fact, it's yes until it's no. And so you actually you're getting no information whatsoever from her other than the fact that she is currently feeling her baby moving. Whereas if you ask her a question like, tell me about your baby's movements, it doesn't have to be that, but it needs to be an open-ended question. What that means is that she then has an opportunity to talk to you about her experience of her baby's movements. It also empowers her to get to know who her baby is and how her baby is so that she can immediately report a change to you. I absolutely love this photo because one side is the 3D fetus and the other is the newborn. And you can tell it's the same baby, can't you? So the woman is empowered to know that her baby is not going to change character or behaviour. If her baby is a morning person, her baby is going to be a morning person. If her baby is an evening person, her baby is going to be an evening person. If her baby is a shy person and doesn't respond to anybody's touch or anybody in the room, then the baby is likely to be like that when they're born as well. So empowering the woman to get to know her baby is a way of keeping the baby safe, because the mother is with the baby 24/7 and you only likely see her for a few minutes 8 to 10 times in the pregnancy. So it's really important that she knows how to get to know her baby. How you document fetal movements. We all would have seen fetal movements felt as the documentation. And again, working in a team, it does not telling your other team members anything about what's happening with those movements and if they're changing at all. Whereas if you say something like, Kate is currently feeling the baby move all the time and notices strong movement when she goes to bed in the evening, the next person who looks after Kate will then be in a position to say, well, you said last time that he's moving all the time. Oh yes, but he's calmed down and he's getting ready for birth. No. Getting ready for birth is not something that normally happens. Perhaps we need to assess your baby. So dispelling some common myths. That one, it's normal for a fetus to move less frequently close to term. It's really good to see that clinicians in this room understand that that's not true. However, women, their mothers and their partners will often think that it is true. And so it's really important for us to inform women that that's not the case, and that it is unusual for a baby to move less close to term. This is a really busy slide that you probably can't see, but Billy Bradford, who I mentioned before, this is her research, and again it's pointing out in this cross-sectional cohort study that was done with babies who were live-born only, so no stillborn cases. You can see throughout this document or this table that increase in strength, increase in frequency, one episode of vigour or no excessive vigour, all confirming what those earlier case control studies have confirmed as well. It is not normal for the baby to move less close to term. A well fetus will move how many times? Wow. At least 10 times. Tends to be the belief that's held by some clinicians. 10 times in an hour, 10 times in a day is still very commonly believed by clinicians, and also, importantly, mums believe that too. This 10 times comes from quite an old study, one that was published in 1989. And it's been misinterpreted and misquoted and miscited quite a lot, and it's the reason why we think 10 times in 2 hours is the normal thing. But what they did was they had over 2,000 women, or 2,500 women actually, and they asked them for the elapsed time required to appreciate 10 movements. And the mean time was around 21 minutes. So the vast majority of women had one standard deviation being between 3 minutes and 39 minutes. The vast majority of women sat within that range. So to be talking about a 10 movements in 2 hours as being normal is actually quite incorrect. And this study says that actually patients in whom 2 hours had elapsed without 10 movements happening were actually being asked to report to delivery suite for further evaluation, because that was 5 standard deviations away from the mean. Really, 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 really rare. So women with concerns about decreased fetal movements should have something cold to drink or sweet to eat to wake up the baby. And again, it's great to see our clinicians are getting this right. However, we have particularly grandmothers and fellow mothers of our women saying, oh, you're concerned, have something sweet to drink before you present. So those that really needs to be a myth that we dispel as care providers, to be saying to the woman, listen, if you notice that your baby's movements change, don't waste time having something cold to drink or sweet to eat. Come on in straight away. So there's actually evidence that suggests that even if you wire somebody up with a glucose infusion, that it doesn't make the baby move. But importantly, even if it did, it cannot possibly improve fetal well-being. So that's the really key point there, that if you are trying to wake the baby, you're still not making the baby well by having a cold drink. Women with an anterior placenta may find it more difficult to perceive fetal movements. What do you think? Yes and no is the answer. So the anterior placenta can be the reason why the woman has a delay in her initial feeling of the baby moving. So those initial little flutters and ticks that the baby first makes, she might find it harder to perceive those because the placenta is anterior. But here's the really important thing. If she notices a change in her baby's behaviour, particularly towards the end of pregnancy, then you can't be saying to her it's because your placenta is anterior, because the placenta is in the same position as it's always been in. So the thing that's changed is the baby's behaviour, nothing to do with the placenta at all. So once she's gotten to know her baby's movements, the anterior placenta is not a factor in reporting decreased fetal movements once the woman is aware of what her baby feels like. So, maternity care providers should have regular conversations with women, and it sounds like you all are, but I'm probably preaching to the choir. There are myths that need to be dispelled, and you have a role, a very important role in dispelling those myths. And any concerning alteration in fetal activity, strength, frequency or pattern need to be reported and properly assessed. Thank you. And I just have one final thing that I've brought along. I'm part of the Stillbirth CRE Decreased Fetal Movement working group, and they have produced a new care pathway. And I thought that given everybody's interest and expertise in this room, that if you are interested in having a look at it and perhaps providing some feedback about it, that you could follow this SurveyMonkey link or the QR code. I have some of these on the table as you leave as well. Thank you for your attention. I look forward to your questions later.